The use of single-use electrodes, or as they are often called, disposable, for recording a resting ECG in the 12 standard leads is often required in pediatric practice and for active patients. This procedure is described in the guidelines for ECG recording by the Russian Society of Cardiology, published in 2023, in Drozdov, the Russian Journal of Cardiology. Let's consider the features of using single-use electrodes. They come in different types. Some have a central contact like this. In that case, it is most convenient to use a connection with a crocodile-type clip. And there are so-called Petal electrodes. They look like this, with a very convenient method of attachment. For this, either special cables or special adapters are used, which can be connected to a regular patient cable. The use of single-use electrodes requires skin preparation at the sites of their placement. Everything else is done similarly to the use of regular reusable electrodes. A fundamentally important point is the placement of the electrodes on the chest. The effect is that shifting them up or down leads to changes in the electrocardiogram pattern in the chest leads. Therefore, it is crucial to determine the position of the fourth intercostal space. For educational purposes, we demonstrate this with the patient in a sitting position. There are different methods for determining the position of the fourth intercostal space. The most foolproof method is determining the position of the fourth intercostal space from the jugular notch of the chest. We palpate it and move down to the sternal angle. In adults, this is the site of the fused sternal joint. At its level is the second rib. Immediately below is the second intercostal space, followed by the third and fourth intercostal spaces, where the electrodes C1 and C2 will be placed. Determining the position of the fourth intercostal space relative to other anatomical landmarks can lead to errors, which in turn can disrupt the ECG pattern in the chest leads. When using disposable electrodes, it is necessary to check their expiration date. It is printed on the packaging near the hourglass symbol. When recording an ECG using disposable electrodes, it is essential to degrease the skin. This is easiest to do with a regular alcohol factory wipe. We degrease the skin course on the limbs and izriškas on the chest. Order accordingly, we also degrease the skin. We wait for the skin to dry. That's why I started with the limbs. And in fact, by this time the skin has already dried. For convenience, I immediately prepare the number of electrodes I need so I don't have to take them out multiple times. When using disposable electrodes, the placement for recording a resting ECG is the same as for reusable electrodes. We attach the electrode to the limb and connect it. If we have a different connector design, we connect first, then attach. Next, we attach the chest electrodes in the same way as when installing reusable electrodes. We determine the position of the jugular notch of the sternum. Its angle is the level of the second rib, just below, is the second intercostal space, then the third and fourth. Accordingly, electrodes C1 and C2 will be placed to the left and right of the sternum. Since I have grabber-type clips, I can first attach the electrode to the predetermined anatomical location and then connect the corresponding clip according to the appropriate color. With these clips, you can also do the opposite. I can first connect the electrode, as no pressure needs to be applied to the center of the electrode, and then attach the electrode to the appropriate location. We place electrode C3 in the middle between the already attached C4 and C2. Then we place electrodes, C5 and C6 at the same horizontal level as electrode C4. Accordingly, along the anterior axillary line and the mid-axillary line, we will now place the electrode. And we achieve quite an acceptable signal quality. On the display, film electrodes, also known as Petal electrodes, are most conveniently used with alligator clips with a contact pad like this. To make it easier to separate the electrodes, we disassemble the surface along the cut lines in this manner. It's most convenient to work in gloves. First, connect the appropriate clip. Detach the electrode and apply it. Take the yellow electrode. Next, take the brown electrode. Then place the C3 electrode. Green exactly in the middle, between the brown and yellow electrodes. And then, very carefully and precisely, place the C5 electrode along the anterior axillary line at the horizontal level of C4, ensuring it is positioned exactly and correctly. And the C6 electrode, again, very precisely along the horizontal line, and ensure that the cardiogram is being recorded with sufficient quality, ensuring everything is absolutely correct.